Hello, my name is Ashley Gifford, and I'm a speech pathologist who works primarily with middle school students in grades 3 through 6. At the middle school level, there are many areas that are focused on to assist in building on skills children already possess, as well as to compensate for individual weaknesses. I would like to provide you with a brief overview of some areas that are focused on during therapy sessions. If you have any particular questions, please feel free to email me at agifford@greenwichcsd.org. A large area of focus for many students is to develop their vocabulary knowledge and use. Enriching students' vocabularies is essential for language development and reading comprehension. It plays an important role in academic success. According to the National Reading Panel, in 2000, a stronger vocabulary has been linked to the development of reading skills. Several strategies are taught to assist students in learning and recalling vocabulary. At the middle grade level, vocabulary is mainly addressed through curricular themes and literature lessons, as these provide more meaningful opportunities for the students. Pre-teaching unknown words is helpful to facilitate comprehension. Students are introduced to vocabulary through pictures or objects, as well as within the context of a sentence. Words are discussed as a group, and students are encouraged to use vocabulary in their own examples. Word maps assist students in thinking about words in a variety of ways. A word map includes the target vocabulary word, part of speech, synonym, antonym, definition, and picture. Students also use the word in their own generated sentences to demonstrate understanding of the word. Flashcards are often developed, and mnemonics or memory tricks are taught. Students also develop picture dictionaries, as visuals often assist in recall. Prefixes, suffixes, and root words are taught to help to decipher and memorize words. The children also participate in several activities involving synonyms, antonyms, analogies, and multiple meanings. It is also beneficial to have the students engage in categorization, classification, and association techniques to improve their vocabularies. The use of a computer is often a great motivator for students. Vocabulary-related lessons are often incorporated on the computer using vocabulary that has been focused on. Another area of focus may be to improve students' comprehension of passages or literature material that is read to them or read independently. Schema is used to activate prior knowledge. Graphic organizers help students with tasks such as comparing and contrasting information and recalling story elements. Students also learn how to make predictions, draw conclusions, summarize, and make inferences to assist them in developing comprehension of the text during and after reading. Strategies to help recall the main idea and details include highlighting key words, reading questions prior to reading, chunking, and note-taking. A visualization strategy is taught by having students create mind images using their 5 senses while listening to stories. This strategy helps students recall details and understand what has been read. Children need to be able to follow directions in everyday situations, such as when following oral directions given by teachers, following directions on tests, or asking someone to give them directions to a specific place. Many students need to learn listening skills, as it is not automatic for everyone. Children may be taught ways to be good listeners, such as using whole-body listening, or being taught how to identify listening cues, such as "this is important" or "listen carefully." Basic concepts and vocabulary are taught through paper-pencil tasks, barrier activities, crafts, and cooking experiences. Self-advocacy strategies are essential to teach children. These skills help them when they do not understand directions that are presented to them. Some of the strategies discussed include asking for repetitions, asking a communication partner to raise his or her volume, or asking to have directions written down. Sequencing involves putting events in a logical order. This is an important skill in areas such as reading and writing. Sequencing opportunities are provided through crafts, cooking, cut and paste, and literature lessons. Written language is more formal than oral language. Children are taught grammatical rules, learn sentence structure, and types of punctuation. Graphic organizers and outlines are also helpful tools to assist in developing paragraphs and logical ideas. Students engage in opportunities to practice various types of writing to develop their written language skills. Pragmatics involves how we use language when we communicate in social situations. Children who demonstrate difficulty with social language may encounter confusion with conversational rules, make irrelevant comments, or have difficulty initiating or maintaining conversations appropriately. They may also exhibit issues with nonverbal language, including a lack of personal space, eye contact, and body language. A lack of social skills can hinder the acceptance from others. Social skills are addressed through role plays, social stories, social scripts, group projects, and cooperative educational games. Children with auditory processing weaknesses may exhibit poor listening behaviors, have difficulty understanding orally presented information in the presence of background noise, have poor auditory memory abilities, difficulty following directions, making inferences, understanding figurative language, as well as may have reading and spelling deficits. A speech pathologist does not diagnose an auditory processing disorder. However, he or she plays an important role, as a speech and language evaluation can provide valuable information to refer a child to an audiologist for an auditory processing evaluation. Treatment is based on the child's individual needs. Some students benefit from environmental modifications to help improve the listening conditions, such as sitting close to the speaker, having visual aids present, or staying away from auditory distractions such as heaters. For some individuals, auditory trainers are provided to eliminate extraneous noise so that the child is able to focus solely on the speaker's message. Compensatory strategies may be taught, such as pre-teaching vocabulary, checking for understanding by having the child repeat or rephrase, and gaining attention prior to giving directions. Students may need to strengthen their language, memory, and problem-solving skills through various lessons and strategies. Another area of focus in speech therapy is to improve articulation, or how sounds are produced, and overall speech intelligibility. To assist in making their sound practice more meaningful, words are typically chosen using spelling words or words from a current unit of study. There is a progression of working on a sound. It is helpful to first begin by increasing students' awareness of correct productions through auditory bombardment. This involves providing repeat exposure to the correct production of a child's mispronounced sounds. This strategy aids in the child's ability to hear incorrect phonemes in his or her own speech. After auditory bombardment, children begin to produce a sound in isolation and then progress to syllables, words, phrases, sentences, reading, and conversation. Disfluencies occur when there is a breakdown or disruption in the flow of speech. Everyone experiences disfluencies at one time or another. Many children go through a normal disfluent period around the ages of 2 to 6. Stuttering typically consists of prolongations, sound syllable repetitions, interjections, blocks, revisions, incomplete phrases, and/or show signs of tension in their face, neck, or shoulders. They may also show signs of frustration. The speech therapist may teach children specific skills to improve their ability to communicate, such as monitoring their rate of speech, learning to control breathing, and producing words with less tension. It is also helpful to provide communication partners with suggestions on ways to help children who stutter, such as to make sure they do not finish the child's sentences, don't rush the child, and provide a positive, non-stressful environment. Voice disorders are characterized by an unpleasant quality in the voice. Examples may include a harsh, hoarse, or breathy quality, abnormally high pitch, or an inappropriate volume. Before treating a child who demonstrates characteristics of a voice disorder, the child must be examined by an ear, nose, and throat doctor. The findings from that examination will help to determine the appropriate course of intervention.